Hello, my name is Ishana, and in this video essay, I'll be discussing how I would approach and maintain a working relationship with an individual affected by addictions using a harm reduction approach. In my own words, harm reduction is a passionate, evidence based approach that focuses on minimizing the negative consequences of substance use rather than insisting on abstinence as the only goal. It recognizes that people use substances for complex reasons and that recovery is not a one size journey that fits everyone. According to the Canadian Centre on Substance Use and Addiction, harm reduction includes strategies like supervised consumption sites, needle exchange programs, and access to naloxone. These interventions aim to reduce the risk of overdose, disease transmission, and social harm. The core values of harm reduction include dignity, autonomy, and respect. It supports individuals where they are without judgment and empowers them to make informed choices about their health and well being. Reflecting on my own Miss Cosman, my personal roots and influences, my upbringing emphasized compassion, community, and non judgment. These values align closely with harm reduction. However, I also grew up in a context where addiction was often stigmatized and the abstinence was seen as the only real recovery. This created some internal conflict with me initially, but learning about harm reduction has helped me challenge those beliefs. I now see that meeting people where they are is non-enabling, it's empowering. It's about building trust and supporting people in a way that respects their lived experiences. Professionally, my education and volunteer work in community health have shaped my approach to supporting service users. Harm reduction aligns with my belief in holistic, client-led care. It allows for flexibility and responsiveness, which are essential in real-world practices. When working with individuals impacted by addiction, I would approach them with empathy, courtesy, and cultural humility. A trauma informed lens means recognizing that substance use is often rooted in pain and survival. An anti oppressive approach means acknowledging systematic barriers and power imbalances that affect access to care. I value harm reduction because it prioritizes safety, autonomy, and dignity. However, challenges include social stigma, limited funding, and the need for ongoing education among practitioners. These can impact treatment planning and the services users' recovery journey. Initially, I had concerns that harm reduction might conflict with long term recovery goals, but through this course, I've come to understand that harm reduction can be a stepping stone towards recovery or a goal in itself. It's about reducing harm, not reducing hope. In conclusion, I see harm reduction as a vital part of my future practice in the addictions and mental health field. It aligns with my values, both personal and professional, offers a respectful, realistic path to wellness. Moving forward, I want to deepen my understanding of harm reduction by engaging with community organization, attending workshops, and listening to the voices of people with lived experience. This will help me grow as a practitioner and better my support to those I serve. Thank you very much for watching.